Good morning, everyone. Today we're going to talk about some of our more common braces emergencies, or comfort visits, as we would say. Some of the more common issues that happen in braces are, of course, wire pokes. And I'm going to show you a couple of different scenarios for wire pokes. The first is one of the individual wire ties is poking in the front or in the back, which you can sort of see here. The best way to deal with a wire poke like this at home would be to use a clean pencil or a new pencil eraser and just go ahead and tuck that poking wire up and underneath so that it's no longer poking into the lip or the cheek. The other most common kind of wire poke is where the wire comes out in the back or is poking at the cheek. In this circumstance, a clean pair of nail clippers does a great job just being able to access the area where the patient's most comfortable, and you just go right in with the clipper and clip that end off there. The other helpful tool when you have a wire poke is, of course, wax. And all of our offices are stocked, even at nights and weekends, with wax in mailboxes in front of the office. They come in these little packs, as well as rubber bands too. With wax, they come into individual strips here. You can just take a small strip, take about half of that, roll it into a little bit of a ball, make it warm, and place it onto the area of the wire or the bracket that might be poking and causing irritation in the lip. Don't be shy in the amount that you use. Make sure it's comfortable. Wax sticks best to a dry surface, which is somewhat silly to say in the mouth, but the drier it can be, the better it will adhere. If there's a wire poke all the way in the back and you just can't keep that area dry, in a pinch, just some sugar-free gum will do a nice job of covering that area temporarily until it can be fixed as well. The second most common kind of emergency or comfort visit that we hear about is, of course, broken brackets. And so in the back here, you can see the bracket is off center of the tooth. In this case, again, this really isn't an emergency. A broken bracket doesn't have to be fixed urgently, but usually this can just be repositioned either with a finger, or again, you could use the clean end of a pencil eraser just to push it back onto the center of the tooth like this. And that should be fine. The only other thing that we occasionally hear about is pain associated with orthodontic adjustments or teeth moving. Pain is a normal consequence of orthodontic treatment. Many times in many of your kits you have little chewies or therapy wafers. Chewing on these for about 5 to 10 minutes can help with pain, but of course other things you would do for pain management is good. But pain is a normal consequence of orthodontic treatment. And those are the top 3. Thanks.